A project in jeopardy. His hopes for healthcare reform in doubt. The president goes to Congress and to the American people.
I will not permit reform to be postponed or imperiled.
But emotions run high in Congress and on the streets of America.
He keeps shoving it down our throats, and that's something that I don't agree with.
Tonight on Straight Talk, 3 takes on healthcare reform. Oregon's Archimedes movement. Longtime health and medical journalist Andrew Holtz, and author and NPR contributor T.R. Reid. From News Channel 8, this is Straight Talk with Laurel Porter.
Good evening, and thank you for joining us tonight on Straight Talk. I'm Laurel Porter. President Obama tried to reframe the debate over health care reform this week with his speech to Congress. Americans are now considering the options. Joining me now with their thoughts on health care reform, welcome to my first guest tonight, Liz Baxter. She's the executive director of the Archimedes Movement. That's a grassroots organization founded in 2006 by former Governor John Kitzhaber, who recently announced he's running again for a 3rd term. Also joining us tonight, Andrew Holtz, an independent health journalist and former CNN medical correspondent who lives in Portland. Thank you both for joining us tonight on Straight Talk.
Yeah, thank you.
A lot of critics said the president was going to have to hit it out of the park to try to regain his political footing on the health care reform issue with his speech. Do you think he was able to do that? Let me start with Andrew.
Well, I'm not a political operative, so it's hard to judge exactly, but he did do some things that in conversations with people that he had to do. He had to give some details. There's a lot of fear, confusion, all of the attacks that happened during the healthcare town halls in August needed to be answered in some way, and he did include a number of specifics to try to say, for people with insurance, who really politically are the most important, they're the ones who vote, what does this do for you? And to specifically answer the questions that they heard. Whether or not he answered the concerns of people like the one you had in the open there, saying he's trying to shove it down our throats, that's another issue. Is the public or their representatives, what are the political calculations going on in terms of deciding, is it politically more advantageous to move forward, or is there still such great fear of change out there that will encourage Congress to be more timid again?
Liz, what do you think?
Well, I think it partly depends on who it is that's answering the question and who's decided what the ballpark is. Because I think that those folks who want to have detail are really the policymakers. They're the folks among us who actually know what it takes to create and run a health system. But for the American public, I actually think that last, maybe minute or minute and a half of his speech was where he hit it out of the park, because he was able to bring it back to the emotional level for the public and really both the crisis and the impetus for us to do something significant and profound. And it was the part that really moved me the most.
And he called it a social justice issue
Yes.
at the end and talked about Ted Kennedy. Let's listen to a little sound from President Obama when he talked about shaping the future and not fearing it.
I understand how difficult this healthcare debate has been. I know that many in this country are deeply skeptical that government is looking out for them. I understand that the politically safe move would be to kick the can further down the road, to defer reform one more year, or one more election, or one more term. But that is not what this moment calls for. That's not what we came here to do. We did not come to fear the future. We came here to shape it. I still believe we can act, even when it's hard.
And as you mentioned, Andrew, he was being criticized for not offering details, and he offered a few. Let's look at just a few of the bullet points, the highlights from his speech. He said it would cost $900 billion over 10 years, avoiding that $1 trillion mark without adding to the deficit, according to the president. Everyone must have health insurance, so a mandate there. Subsidies would be offered for those who can't afford it, and there would be a ban on coverage denials for pre-existing conditions. Let me ask you, Liz, your group, they are opposed to this mandate, I understand, if it's only for private insurance, that every American would have to have insurance, but they'd have to choose from private insurance. Will you explain that?
Well, we have a leadership team, and when they looked at this discussion about the public option, they saw it as not so much a thumbs up, thumbs down issue, but it was really, if we were going to require everyone in this country who doesn't currently have insurance to purchase something, that Americans should have a choice, and that they should have a choice not just between public and private, but that they should actually have a choice knowing what it is that they're purchasing, where is that going to move them further down the line, is it affordable, is it actually covering the kinds of things that are going to help them both move towards being healthier and maintain that health. And that by trying to stick within this, kind of dichotomy of public-private, we were losing the fact that there's so much more about this issue than just is it this or that. And so our group said, we actually think that, if Americans are going to have to wake up one day and say, Congress has passed a bill requiring us to do something, there has to be choice in that.
Let me ask you, Andrew, this was something that the president opposed when he ran against Hillary Clinton. That was her idea. Now he's reversed his position. Why do you think?
Well, actually, this is one of the things that I think if you look at anything, say, what has changed this year in the politics of health care reform? Discussion of a mandate is a dramatic change. A few years ago, there were a lot of policy wonks out there who said you can't make the financing system work as long as healthy people can opt out and leave only people who already have health problems in the system. And you have to have everyone in or it's not going to work. But trying to discuss a mandate was seen as political death. That's changed. I mean, that is really one of the fundamental things that's advanced in the discussion. There is broad, if not acceptance or glee about it, at least a willingness to consider the fact that, okay, maybe I'll accept a mandate if, on the other hand, I get a guarantee that I'm not going to be closed out of the system, that there is a trade-off there. So I think that, and I don't know what went on in the White House, but probably a lot of people told him there is no way that it could possibly work out from a financing standpoint if you allow people to opt out. Because for a young person, especially starting out a career, not making much money, who doesn't have any health problems, why would you get insurance? Because you're very unlikely to need it. And even if you did need it, you don't have really the assets or anything. You could just declare bankruptcy and move on and just become part of that uncompensated care and allow all the costs of your care to be shifted onto others. That's the way the system works now. In order to change the financing system, you have to get everyone in. The mandate's part of that, and I guess Obama finally realized that the numbers wouldn't add up unless a mandate was part of the bill.
Let's talk a little bit about bureaucracy, and I want to give a Republican viewpoint on that. During the response to the president, they talked about all the layers of bureaucracy they thought this health care bill was going to add. And when you talk about mandate, you think about, well, who's going to enforce that? They're talking about fines for people if they don't get insurance. Are we going to have another IRS sort of layer of making sure everybody has insurance? Let's listen to what the Republicans said about bureaucracy.
I will not.
$0.85 to 90 cents of that healthcare dollar nationally are spent on medical care. It's less than 10 to 15% of that health premium dollar that goes to administrative costs of insurance companies.
I read the bill Democrats passed through committee in July. It creates 53 new government bureaucracies, adds hundreds of billions to our national debt, and raises taxes on job creators by $600 billion. And it cuts Medicare by $500 billion while doing virtually nothing to make the program better for our seniors.
That was Representative Boustany talking after the president's speech. Before that, you heard from a representative from Regions, the health insurance company. That was a little bonus talking about how they're not at fault. But let me just talk more about the bureaucracy here. Don't the Republicans have a point there, Liz?
Well, certainly nobody wants to, pay for more bureaucratic nightmares. I mean, we all would love to see something simplified, efficiencies, getting really a better return on the money that we spend. I'm not exactly sure what's in that bill and whether it really creates 53 new bureaucracies, but I do think it's an example of how we've got folks on both sides of the aisle who are having very different conversations. And so it isn't that they're actually talking together, hopefully to come up with some common solution. One side is talking about one set of issues, the other side just says, now they're done, we're going to talk about a different set of issues. And we really have to get to a point where this debate is happening, across the aisles, across the houses, and so that they can come up with a solution that they feel is in the best interest of the American people.